Hey everybody, welcome back for another episode of Physio Show. You know, it may not seem like it, but we all have more in common than you think. When it comes to knee arthritis, there are some experiences that almost everybody shares. So you're not alone. Today, let's explore 5 common struggles that many with knee arthritis face and share some tips and tricks to manage them effectively. Let's kick things off with one of the less commonly discussed challenges, quadriceps weakness. This issue often goes hand in hand with knee arthritis. The quadriceps plays a crucial role in stabilizing and supporting your knee joint. When you're dealing with knee arthritis, pain and discomfort can lead to reduced activity levels, resulting in muscle weakness. This is your body's natural response to pain, but it can create a vicious cycle. Weakness leads to less stability in the knee, which increases pain, leading to even less activity and further weakness. You might find it a challenge to perform daily tasks like climbing stairs, standing up from a seated position, or even walking extended durations. So to tackle this issue, consider incorporating some simple strengthening exercises targeted to your quadriceps. Start slowly and gradually increase the intensity to avoid aggravating your joint pain. If you're unsure where to start, working with a physical therapist can provide valuable guidance on proper form and help create a tailored exercise plan that meets your specific needs. Strengthening those quadriceps can lead to noticeable improvements in your pain levels and overall mobility, allowing you to enjoy daily activities more easily. One of the most prevalent complaints among those with knee arthritis is joint pain. It can range from dull aches to sharp, stabbing, debilitating pains that interfere with daily activities. You have likely noticed that pain tends to flare up during weight-bearing activities, like climbing stairs, getting up from a chair, or even running. But what can you do about this? Well, start with conservative pain management strategies. Resting the affected joint is crucial when you feel a flare-up coming on. Reducing activities that put excessive stress on the joint can help minimize pain and swelling. Incorporating ice therapy is also effective. Applying an ice pack to your knee for every 15 to 20 minutes or so can help reduce pain and inflammation. And if you want to up your icing game, I suggest getting a cryo wrap, which provides a deeper and consistent level of cooling. I provided a link to a cryo wrap that I like in the description if you're interested. Physical therapy plays a vital role too. A skilled physical therapist can design a customized exercise program that strengthens the muscles around your knee while improving flexibility and stability. Low impact exercises like swimming, cycling, or yoga can be beneficial without putting too much strain on the knees. They can also offer tips on reducing excessive loading through the joint throughout the day. Weight management is another key aspect of managing knee arthritis pain. Excessive weight adds additional stress to your knee, worsening your pain. Even losing just 10 pounds can take about 40 pounds off your knee joint. A registered dietitian can help you develop a nutritious eating plan focused on anti-inflammatory foods that support your joint health. For medication, over-the-counter pain relievers like ibuprofen or naproxen can provide effective relief for many individuals. These medications help reduce inflammation and alleviate pain. Now, if you would prefer a more localized approach, consider topical pain relievers like Voltaren, which can be applied directly to the skin over the painful area. Remember to consult your doctor before taking any medications. Corticosteroids, which mimic hormones your body naturally produces, can also be injected directly into the knee joint to reduce inflammation and help alleviate pain. This localized approach allows for higher concentrations of medications at the site of pain, leading to more effective results compared to oral medications. However, keep in mind that corticosteroid injections are not a permanent solution, and there's a limit to how many injections you can safely receive in a year. If you're looking for more in-depth strategies and tools to manage your knee arthritis, check out a free ebook. It's packed with tips and insights specifically designed to support your knee health. You can find the link in the description below. Another common symptom is stiffness, especially after periods of inactivity like sitting for a while or the first thing in the morning. This stiffness can be frustrating, making it difficult to get moving. To combat this, incorporate gentle stretching and range of motion exercises into your normal routine. Well, all this talk about mobility, why is it so essential? Well, movement helps distribute synovial fluid, which lubricates the joints and nourishes the cartilage. Think of it like greasing the wheels on a bicycle. When everything is well lubricated, it runs very smoothly with less pain. Regular movement not only eases stiffness, but also strengthens the muscles around the knee, especially the quadriceps and hamstrings, which stabilize the joint. So consider incorporating a morning routine that includes simple stretches targeting your knees. Just a few minutes of stretching can make a significant difference in your flexibility and comfort. Swelling is another common symptom for many individuals with knee arthritis. This inflammation can be uncomfortable and significantly limit your movement. When your knee swells, it can feel tight and restrict your range of motion, creating a frustrating cycle where pain leads to decreased movement, which in turn exacerbates swelling. So what can you do about the swelling? Well, one effective strategy is to use compression sleeves. These provide gentle pressure around the knee joint, improving circulation and reducing swelling. Compression can also support the joint, making it feel more stable, which is particularly beneficial during physical activity. Elevating your legs is another simple yet effective strategy to reduce swelling. Ideally, elevate your legs above the level of the heart to promote drainage of excessive fluid from the knee joint back to the circulation. This position can be especially helpful after a long day on your feet or following activities that may aggravate your knee. And sitting can also be trouble with swelling, as your knees are in a dependent position, meaning gravity is going to just pull all that swelling into the legs, so when you get home from work, throw up those legs. And when conservative measures like compression sleeves and leg elevation aren't enough, a procedure known as arthrocentesis, or knee aspiration, can be helpful. This involves using a needle to remove excessive fluid from the knee joint, providing immediate relief from swelling and discomfort. While effective, it is usually considered when more conservative treatments have failed, and it's not a permanent solution. Swelling may return if the underlying causes of your arthritis are still present. Lastly, let's not overlook the emotional impact of living with knee arthritis. Chronic pain affects not just your body, but also your mental health. Research shows that poor mental health can lead to more intense pain and feelings of frustration, anxiety, and even depression, often accompanying this condition. You might feel isolated due to the limitations arthritis places on your activities, but here's the good news: you don't have to navigate this journey alone. Seeking support is crucial. Consider reaching out to mental health professionals who specialize in chronic pain for coping strategies. Techniques like cognitive behavioral therapy can be particularly effective in helping you reframe negative thought patterns. Support groups, whether in person or online, can also be a fantastic way to connect with others who truly understand what you're going through. Sharing experiences and advice can help you feel more supported and less isolated. Well, if you found this video helpful, please hit that like button and subscribe to the channel for more insights about your body, how it works, and what it needs to keep moving.